Introduction before we move. My name is Dr. Emmanuel Imaku. Yes, Emaku. I'm from Edo State. And with me is this is Mr. Jonathan. He's the director of our college, Haley's College of Osteopathy and Natural Medicine. So he's the one that is taking, he's the acting director. So, but we are here for lecture, right? We are going to do a lot of things. I'm going to take Emmanuel, Jonathan, Mr. Jonathan. I'm going to take some aspects which I believe is not new to you, and he's going to also take an aspect too. So I just want us to pay attention and follow through so that we'll go side by side and understand why we are here. Are we together? Now let's talk about osteopathy. Osteopathy. Now, are we new to osteopathy? Are we new to it? Yes. Okay. Now, what is osteopathy? From the name osteo, bone. What's pathy? Disease condition. Now, it's a compound word of two etymologies now, bone condition, but it encompasses that. Now, it has to do with it is a musculoskeletal. Um, okay, let me put it this way. It is. It has to do with the treatment, prevention, diagnosing. I'll come again. It has to do with diagnosing, treatment, and prevention of diseases or disorders related to the musculoskeletal system. I'll come again. It has to do with the diagnosis, the treatment, the prevention, management or rehabilitation. Management or rehabilitation of disorders relating to the musculoskeletal system. Now, when you talk about the musculoskeletal system, relating to the musculoskeletal system, it's two words: muscle and the skeletal system. All right. There's something called the integumentary system. What is it? The skin. Now, beneath the skin, we have layers, right? If you do anatomy, they taught you about fascia, superficial fascia, deep fascia, all right? The ligaments, the tendons, all these things make up the musculoskeletal system. So when you're talking about diagnosing, treating, prevention, managing, or rehabilitating issues that has to do with the musculoskeletal system, you're talking about osteopathy. Is it clear now? Now, it was founded by a man in 1874. The study of osteopathy was founded by a man called Dr. Andrew Taylor Steele. Dr. Andrew Taylor Steele. Dr. Andrew Taylor in 1874. 1874. That's the 19th century. 19th century. Now you can see that it is a more recent study compared to general medicine. And in this part of this world now, you can see that it is even more recent. And that is why many of us we are here, because for the first time we are just hearing of osteopathy. In fact, the average person, if they come here, they will say osteopathy. They don't even know how to call it because they've not heard it before. All right. So this is a part of medicine that is still is still very new and it's still very important. And also, I want you to take note of this. Osteopathy focuses on the body healing itself. All right. So, whatever thing you do in osteopathy is for the body to heal itself. Whatever we do in osteopathy is for the body to heal itself. All right. Is it clear? Yes. That is why we don't use injections and some of, even if we do, we set the body in a way that the body will heal itself. For example, you may have a headache. You may have a headache. Do you know there are we together? Now, principles of osteopathy. I'm going to be fast because of time. Principles of osteopathy. We need to understand that the body is a unit. Number one, the body is a unit. The body is what? A unit. The head is not different from the leg. The hand is not different from the chest. They are all different units integrating as one. So you must understand that the body is a unit. Number two, the body has self-healing and self-regulatory mechanism. The body has self-healing and self-regulatory mechanism. Some people don't know this. Are you aware that when you have bruises, in a couple of days, the thing will just heal up? Even without taking, yes. That's because the body has the ability to heal itself. Do you know if you have fracture, you know fracture, right? What you just need to do is to set the bone to align. Then the body will heal itself. Do you know that? So whatever we do around it is for the body to quickly recover. That is why we administer drugs like calcium, magnesium, and whatever. Do you understand? But the main focus is that the body does what? Heal itself. We need to understand that. It has the ability to heal itself. We emphasize that in osteopathy. We need to understand that structure and function are interrelated. We did anatomy, right? What is anatomy? The study of what? Structure. What is physiology? Study of what? Function. So when you marry the structure and the function together, osteopathy centers on that. So that's why we talk about the body structurally. Okay, Dr. Gold is calling me now. All right. Maybe he's trying to find out. Okay, excuse me. Related. Very, very important. All right. So you don't study anatomy without physiology. And you don't study physiology without anatomy. And you don't study osteopathy without the knowledge of anatomy and physiology. You must marry those two knowledge together. So we must understand that all these principles we've spoken here, rational treatment is based on this principle. You must understand that the body works as one. Number two, the body has the ability to self-regulate and self-heal itself. Number three, the body, the structure and the functions are interrelated. These principles are very, very important. Is it clear? Any questions so far? Please pay attention, okay? Now, what is the goal of osteopathic treatment? What are the goals? The goals of osteopathic treatment. Why do we treat people using osteopathic means? Number one, it reduces pain. Pain. I told you, not see, it is not everything you take drugs. It is not everything you take drugs. Number two, it enhances body function. The goal of osteopathic treatment is to enhance body function, to make sure the body works very well. Number three, restore mobility. What is mobility? Movement, yes. to restore mobility. You can move your hands, right? You can move your legs. Some people cannot do this with ease. With ease. So what is our job? We help them do it. We deal on stroke patients here. Most times you will agree with me that many of them have problem with their motor recovery. So what do? We help them out. Some of them even trying to walk is difficult. We need to train them on this. To what? To restore mobility. Another one, prevent recurrence of injury. Prevent recurrence of what? Injury. To prevent the recurrence of what? Injury. Another one, to improve circulation. Very important. This one now, improve circulation. Very, very important. Now, okay, I'll be very, very fast. I wanted to do one or two, explanation with maybe one or two persons. Now, we have a mixed class of both elderly and young people, right? Now, there are certain things that an elderly person and a young person will do here. An elderly person may not be able to do it with ease. Number one, age, right? Now, I may call two people out now. I'll say, okay, stand attention. As simple as that. You'll be surprised that not everybody can stand at a still position. Some will be crying on their way, even back. And sometimes the thing responsible for this, apart from the structure, is poor circulation. Poor what? Circulation. And that has to do with blood, nerve, of how they travel and all of that. I won't go into that because I know that's your field now. Now, another one is promote overall health. The goal of osteopathic treatment is to promote overall health. To promote overall what? Health. Another important one, which is the last one I'll take here, is to improve posture. To improve what? Like I said, some people ask them to stand right. They can't even stand right. Number one, their posture. It is usually said that aging begins with the leg. I don't know how true, but you will agree with me to a great extent that aging begins where? The leg. Ask some people to stand for 5 minutes. Ask some people to stand for 10 minutes, 20, 30 minutes. You will see the difference. Some people will not be able to take it. Even some people that are 60 years old, ask them to stand for 10 minutes. They will do it better than 30-year-old people. Osteopathy will help to improve this. So don't blame everything on age. It's a lie. Yeah, but it is very common out there now. I can point and pick some persons who are having problem with their waist here. Okay, if you're having problem with your waist, let me see your hand. It's not something to shy about. Your waist, sometimes you may have pain. You may have pain from your lower back, your waist. Sometimes the pain will radiate down to your leg like this. How many of you? Yes, you are in that category. Have you heard of sciatic pain? Sciatica, that's what they call it. You've heard of, like I said, lumbar spondylosis. There are some other ones. Let me don't go there. We'll meet some of them. Lower back pain. Okay? Example, your neck pain. All right? Hip pain, shoulder pain, arthritis, knee pain, sciatica, sport injury. They are musculoskeletal disbalance, then to come with pain. These are musculoskeletal disorder. And there's a way we manipulate those things, the person will be okay. Sometimes it can be a one-off manipulation, sometimes it can be a repeated manipulation. So these are low back pain. Then we have, okay, I didn't talk about neurological conditions too. You can add it to it. Musculoskeletal disorder, neurological condition. postural, like that. Now let's talk about neurological conditions. Can you give me an example? The one that has to do with your nervous system. Conditions like stroke, facial nerve palsy, or Bell's palsy, right? Have you seen Bell's palsy before? When you see somebody's face half like this drop, it happens with women who just conceived. Yes, it happened to you. Good. Yes, pregnancy can cause it after giving birth. Those complications can affect the nervous system. I hope you know that it is the brain that controls all these things. So when this thing go to the brain, there's a way the brain will regulate this thing. Then the feedback will just give the person some kind of denatured posture. So you just see the woman's face bend like stroke patient. Yes, the eye will drop, ear will drop. The face, ma?
It's one side.
Yes, one side of the face. We call it Bell's palsy.
Bell.
Bell, like bell, jingle bell, bell. Bell's palsy. Or you can call it facial nerve palsy. It's still related anyway. Peripheral neuropathy, headaches. Do you get? Now, postural disorder. I want to be faster.
Peripheral neuropathy.
Yeah, peripheral neuropathy. You know what that means, Abi? Your peripheral nervous system. Yes, if there is a disorder around your peripheral nervous system, yes. Then we have postural disorders too. Postural disorders. I said something. There are some people they are working like this, right? There are some people they are working like this.
Yes.
You see cases like that. It's not funny, and don't laugh at them. They are working like this. There are some they are working like this. Have you seen cases like that?
Some cannot even stand erect.
Erect. That's what I'm saying.
Some shakara.
I'm not talking about shakara. Now that shakara is what we call behavioral. That one is by virtue of what they've been doing with time. Their brain has now conditioned, yes, conditioned reflex. So that's not their pattern. So they are working like this. You see somebody working like this. That one is different. Now I'm talking about a postural disorder where, okay, let me use an example. Okay, I'll give you examples. Scoliosis. Have you heard of scoliosis? You see somebody, please come on. Try and face this. Go. Wait, just free your body. Have you seen? He's bent. In her mind, she's comfortable like this, but you are the one seeing that it is bent. And she can be walking like this. Go like this. Are you seeing it now? Aha. It's not shakara. It's scoliosis. It's forming S shape. Yes, it's a disorder. It's a postural disorder. So osteopaths manage these issues too. We have them here as strength as well. Ma? Scoliosis. Scoliosis. Yes, scoliosis. You have kyphosis. So we have many of them. Postural disorder. Then geriatric condition.
But sorry.
Yes, ma'am.
Some of these postural disorders develop pattern as a result of positioning.
Most times as a result of lifestyle. When I mean lifestyle, I don't really actually mean bad things. So our general lifestyle, the way we do every day. All right.
Someone used to walk, sit on the table,
Sitting for years.
and then like this, so the person is bent.
There's something they called ergonomics. It is your sitting position when you are seated, the right sitting position. Do you know when some people are giving a have a chair, they are showing you some when some people sit, they will bend like this. It's not supposed to be. Now imagine somebody sitting like this and is bent like this for hours, 5 hours. For those of us that do remote job, or we do job that is restricted to the office, we sit down to work for a long time. Before you know, that person's back is conditioned in a particular way. Now he does it day one, day two, day three, all through the month. He's receiving payment like that. He's working year one, year two, year three, year four, 10 years. Now tell me, what do you expect of that person? The person will assume that position before you know, it become a postural defect. And when we want to correct these things, we will need time too. It's not something that happens one day. So reconditioning, training, treating, rehabilitating will still take time. So rehabilitation cases too, post-operative rehabilitation. When someone goes on operation, you know, there are certain things that will become lost, some characters that will become lost. So we try to help them back. All right. Orthopedic rehabilitation. When someone has fracture, all right, after healing, they will need to start training that leg again, right? Or that hand. That is what will come. Neurological rehabilitation, like stroke. When someone has stroke and the treatment is on too, will still come into play by trying to help them, their posture, their movement, and all of that. Do you understand now? So that is what osteopathy they manage. Now, osteopathic examination.
Sorry, please.
Yes,
What
sir.
about
If you have any question, please you can
people
ask.
that have cramps?
Cramps,
Yeah, what
baja, baja.
aspect of
Yoruba call it baja, baja, or
muscle
muscle
pull, muscle
spasm.
pull. Call it
Muscle
they never
spasm,
like
muscle pull, muscle spasm. And these things are related to what I'm telling you.
that monkey.
Yes, sometimes, yeah, yes. Your leg, you
Some
see, like,
cases due to mineral deficiency or something.
yes, yes.
How related are
Okay. Number one, I said lifestyle, right? The things you eat, the way you behave, your sitting position, your sleeping habits, all right? A lot of things make up your lifestyle. Now, if you look at it, your eating habit, what are the things you eat? What are the components of the things you eat? In the long run, it can affect your posture. I hope you agree with me. The things you eat in the long run can affect your posture. Now, imagine somebody that lives on junk and fizzy drinks, Indomie, and someone in the village that eats vegetables, fresh food. Now, if you are to bring these two people in a space of 10 years together, you won't even think far. Which one will look healthy than the other? The one in the village. That one will look stronger. Why? Because you are what you eat. You are what you eat. Now the other one is that one will look, a lot of conditions will be attached to these ones. Why? Because the things is eating. It's not, it will affect your posture. For example, eating food that is rich in magnesium and calcium, it will help your bones. For example, women, you can see that your hip is carrying your legs. And also, there's a way your hip will become disoriented. It will affect your leg. You see some ladies having K leg or knock knees. It can be as a result. Yes, we have cases where some people childbirth can change a whole lot of things. All right, hormonal interplay and all of that. But we are talking about general well-being. Okay, so that is where feeding lifestyle come. Then we also have the way you walk, the way you sit. There are some people they sit and drive for hours. Now you are doing this job for a long time. It's going to impact on your posture, your waist. Then before you know, we have many of them that will come to our training, they will say, ah, my waist, we know the problem most times. We tell them we are go for scan. So that we convince them, go for x-ray, we convince them their case. That is why exercise is very, very important. Look at it. See, because you are stretching one over the other one. You have injury. Now, oh yeah, you turn your leg. Let's
I'm not sure.
This mommy is very, very smart. I like that. Now, where are you feeling the pressure? On your waist. Sorry. Yeah, come on. Now, some of us. Let's go.
Correct, correct.
Knees, toes, remain like that.
Nice one, nice one, nice one.
Just remain like that.
Receive it. Now. Receive. Yes. Power. Receive.
Now you see, you put. Now there is something called.
Ijo gele je, ma ori. Mi wá sẹ́, mi wá sẹ́, mi wá sẹ́ Jésù.
You are helping your heart. Your heart is happy.
Eso. Ah, grandma is doing it way. Oracle.
When you do this, your heart is happy.
Ẹni Olúwa gbà mí.
It's not like this.
No, I know.
Bàbá ṣàánú mi.
To make the hand more firm, you can hold something like a stick and do it like this to maintain that. And come back to it. Now, as you do that, 20 times or 3 sessions, so that your back